the first myth about VA healthcare we have here is you must have seen combat to be classified as a veteran.
Yeah, this is a big one that we get. I think part of it is the military mentality. Maybe things that people have heard when they were in the service. Yeah, a lot of people think that they have had to have been a trigger puller to be eligible for VA healthcare. We get that a lot too with people that think that you had to have been wounded in war to be eligible for VA healthcare, and quite frankly, neither are true. Of course, we prioritize veterans, and those sort of veterans would get VA health care, but we have a lot of veterans like those that served at Camp Lejeune from 1953 to 1987. As long as they were at Camp Lejeune for 30 days, they're eligible for VA health care. VA will also look and see if you have a service-connected disability. And those things can come from just twisting your ankle in PT. It doesn't have to have been something that, no, really, as long as you were on active duty service when the injury occurred, that makes you eligible for VA healthcare. So, you could have been supporting the mission, but in a different part of the country and not in the war, it still makes you eligible for VA healthcare. Of course, they look at things like income eligibility as well. So there are a lot of different factors that go into it. It's not just exclusive to if you were a wartime veteran or in a war.
So each veteran's circumstance is very unique to themselves, really.
It is, yeah.